Our brain has a huge number of nerve cells. It is estimated that there are about 100 billion nerve cells inside our brain, 15 times the number of people living on planet Earth. Nerve cells all need to talk to each other to send messages to the rest of the body. The frontal lobe is the command center, just like the manager or boss of a large company. The messages from the frontal lobe and other parts of the brain go through complex networks of nerve cells. The nerve cells are connected to one another with a tiny space called a synapse. Let's call it a bridge. We need chemical messengers, neurotransmitters called dopamine and noradrenaline, to transfer messages from one nerve cell to another. Let's call them postmen. The postman would start from the first nerve cell, cross the bridge, knock at the door of the next nerve cell and drop the letters, messages, through the letterbox. The same process continues to another nerve cell, and this is how messages travel around the body. Some postmen return to the nerve cell for recycling before they get a chance to deliver more letters. This is called reuptake. In people who don't have ADHD, there is a good supply of postmen on the bridge, synapse, to continue to deliver letters, so the messages spread across the brain and around the body. ADHD can be caused by a number of factors. It is often inherited, in our genes, and is also influenced by the environment. The ADHD genes speed up recycling of the postman so that more postmen get back into the nerve cell. As a result, there are not enough postmen left on the bridge to deliver letters to the next nerve cell. This causes a chemical imbalance in the brain, disrupting the delivery of the message, or letter. If you don't get clear messages from the frontal lobe, the boss, you can end up with chaotic behaviours such as reduced ability to stay still, reduced attention, poorer planning, disorganisation, and acting without thinking. This would result in common ADHD symptoms of hyperactivity, impulsivity, and inattention. There are two different types of medication for ADHD called stimulants and non-stimulants. After you take your medication, it travels to the bridges between the nerve cells. Once on the bridge, the medication helps to stop the postman getting back into the nerve cell. Reuptake. This increases the number of postmen on the bridge able to deliver letters, and this is how the chemical imbalance may be improved by the medicines. Once the messages, letters, are transferred correctly and regularly across the bridges, your ADHD symptoms will improve, helping you control any hyperactive and impulsive behaviour, and to pay more attention.